So my presentation is on COVID-19, and my name is also Nick. The chief complaint is I have been having difficulty breathing. Additionally, I have developed a fever and cough. Fatigue has also been settling in recently. Subjective that I wrote was a 32-year-old woman visited the clinic presenting symptoms consistent with a potential COVID-19 infection. Starting about a week ago, she described common COVID-19 symptoms, including a persistent cough, difficulty breathing, and a loss of taste and smell. Notably, though, she hadn't taken any medication for symptom relief, and there was no history of any similar episodes. There is nothing that aggravates or makes the patient feel better. And yesterday, the patient noted that they did develop chills, and now they feel fatigued. Symptoms last throughout the day and are generally moderate to severe. Some of the patient's history, well, for the medical history, the patient has a history of asthma and is currently taking inhalers. Family history, well, the patient's mother has a history of diabetes. And social history, the patient does have 6 other roommates, and 3 of them, including herself, work in the healthcare field. So now for my discussion question. How would you approach the evaluation of this COVID-19 patient? Presenting these evolving symptoms, such as the development of chills and fatigue, after just having initially reported common symptoms like a cough, difficulty breathing, and loss of taste or smell. So my first option is immediately prescribe antibiotics to address all the new symptoms and just recommend some over-the-counter medications too for symptom relief. The second option is, well, given these symptoms, I would attribute them to stress, maybe some anxiety, and suggest some lifestyle modifications like maybe more physical activity or eating or some sort of relaxation technique. Then the third option is also, well, considering these symptoms, I would try to make a blood test available to rule out anything else, maybe like a non-respiratory infection, or maybe even offer a referral. The last option, well, considering these symptoms, I would prioritize a COVID-19 test to confirm my initial suspicion that the patient has COVID-19. And then also maybe consider some complications. So I would adjust my management plan to also stress the importance of any self-isolation to prevent potential transmission. So if you need to, you can pause the video unless you already have the answer now. And the correct answer is option D. So in this case, you would want to prioritize a COVID-19 test given these symptoms, especially with their evolving symptoms of chills and loss of taste and smell. So COVID-19, what is it? Well, you guys probably have a very good idea of what it is. It is probably one of the diseases you guys actually know best now. So that's what we have to thank for our generation. So yes, you guys have definitely heard this nickname before, SARS-CoV-2. I'd be shocked if you didn't hear about that. And coronavirus and novel coronavirus. You guys have definitely heard of all 3 of these things. Those are other names for COVID-19, although you guys definitely refer to it the most as COVID or COVID-19. There are no prefix, suffix associations. And the definition, if you do not know what it is already, it could be a severe, but usually pretty mild respiratory illness that is caused by the coronavirus. And main symptoms are fever, shortness of breath, cough, and then you can also develop loss of taste or smell. That could develop a little bit later. In very severe cases, it leads to respiratory failure. Some of your typical symptoms, again, fever and cough, those are some of the most common symptoms you get. We definitely also hear of shortness of breath, Fatigue has kind of been rolling in there too. And then less common, although um, definitely still a lot of people have it, loss of taste and smell and chills and muscle fatigue can 100% also develop those ones too. Here is a little bit of a short video we can watch. It basically is very recent, published just a few weeks ago. It just shows you that COVID-19 is still around, it's still here, it's still dangerous, and people are still getting it.
As you gather with loved ones this weekend, a new COVID warning to alert you to. COVID variant JN.1 is the leading cause of infections in the U.S. The CDC reports the quickly spreading variant has more than doubled between Thanksgiving and mid-December. Coronavirus trackers say they expect JN.1 to become the leading variant around the world in a matter of weeks. The CDC warns that it is rapidly rising. That plus rapidly rising respiratory virus hospitalizations could strain healthcare resources.
So here you can see it's very dangerous still, it's still around. This is this is just January. This is just kind of this month, last month. You can still see there's a lot of infections still happening, and it'll probably be something that we'll have potentially for the rest of our lives.
As you gather with loved ones this week,
So some of the physical exam findings, vitals, you want to monitor your heart rate, blood pressure, temperature, things you kind of do every time you go to a hospital visit. Respiratory, definitely want to take a look at the lungs, looking for anything that does not sound right or look right. And then in general, look at the patient, any signs of fatigue, and throat and mouth. Yeah, want to definitely look for like a sore throat or any other abnormalities. Family history and gender. So yeah, family history is not very significant, but if you do have some sort of underlying disease, it can be identified as risk factors for um, getting more severe cases of COVID-19. And then also some studies have shown that males have been at slightly higher risk. It's not known why. They're still trying to figure it out with these studies. Yeah, ways to treat COVID-19. Definitely used to be none for a long time out there. But for sure, antiviral treatments, those are a big one. Those have been coming in handy. Those have been helping out a lot of people, especially steroids too. And yeah, there are no surgical treatments. Shouldn't be too surprising. And COVID-19 vaccines are, as you know, the best way to protect yourself right now. Um, Not only that, but if you do end up developing COVID-19, it will prevent you from being more seriously affected by COVID. Yeah, then here are the references, and that is it. So thank you so much on listening to my presentation about COVID-19.